Patients always ask me about natural solutions for dry eye or things that they can do at home to help treat their dry eye. Hi everyone, my name is Dr. Saya Nagori. I'm a board certified ophthalmologist, and today we're going to talk about what you can use for dry eyes, what I use for my dry eyes, and what I love about the products that I use. I'll also be tagging some products that I do use, so if you do happen to buy them through the link, we do make a small commission, which helps to support the education that we provide on the channel. Let's get into it. Number one is to treat your meibomian gland disease. I have talked about this so much on this channel before, but there are tiny little glands in your eyelid, and those are called your meibomian glands, and they sit near your eyelashes, and they're responsible for making a layer of your tear film. If you don't have good tear film, this is going to really prevent you from having good tear quality. And there's actually 25 to 40 of those glands in the upper lid and 20 to 30 in the lower lid. And their job is to make the oily layer of your tear film. There's a watery layer, a mucus layer, and then the oily layer or the lipid layer comes from the meibomian glands. And the specific job of this layer is to prevent the tears, your eye's natural tears, from evaporating too quickly. So if these glands are blocked and they're not working properly, your tears are gonna evaporate too quickly, which is going to aggravate dry eye. So the best natural solution is to use some heat and massage to get those glands unclogged and get them functioning optimally. So I have a heat mask, which is microwavable. In addition to the heat mask, when I'm in the shower, I just make sure that I get some warm water and make sure that I'm really just kind of gently massaging my lids, even if it's just for a few seconds. It's something easy that you can do every day, but certainly if you're having aggressive dry eye, or if I'm having an episode of aggressive dry eye, I will use the mask, and I'll try to use it for a couple weeks religiously to make sure that I'm really getting the moist heat from the mask into the lids and helping to unclog those glands. It's really important to also wash the eyelashes with soap and water after you use the heat, because once the oil is expressed and it comes onto the eyelashes, you don't want it to sit there, meaning you don't want the oil and debris to sit on the lashes and just re-irritate the eye over again. So it's important to do heat followed by a warm soapy scrub, but remember to keep the eyelids closed. Obviously, you don't want to get the eye itself very irritated. Now, I briefly mentioned this before, but number two is to incorporate some kind of eyelid massage with the heat. So the heat is going to help to loosen the oil, but if you just do a gentle massage and push very gently on the eyelids, this can help to release some of the oil. Now, when I'm actually seeing patients in the clinic, sometimes a way that I can really see how clogged their meibomian glands are is I'll put a little gentle pressure onto the eyelid when I'm looking through the microscope to see if the gland is actually releasing oil. So if you want to combine those two at home, again, this is a chronic solution, meaning it's long-term. It's not something that you're going to do once and feel better the next day, but you really want to do this consistently. If you can do it twice a day, that's great, but even once a day for the long term is going to be very helpful. The third thing that I use for my dry eyes is I use tea tree oil wipes, and this is because it is protective against something called Demodex mites, and many forms of blepharitis are actually associated with Demodex. And yes, these are tiny little mites that can live on your eyelashes and eyelids, and they can actually cause pretty aggressive inflammation of the eyelids and the glands, and tea tree oil wipes can actually help to eliminate those. I use a pretty powerful tea tree oil wipe, but if you decide to use it, you want to make sure that your eyes are really closed while wiping the lids, because if it gets into the eye, it can cause a lot of burning. And then there's milder ones as well. So I use a combination of both. If I need to wipe my kids' eyelids, I'll definitely use the milder one because I don't want them to have any kind of discomfort when we're using those. The fourth natural solution that I use for dry eye is to really do my best to reduce screen time and try to take screen breaks. So anytime we're doing any focused visual task, so if you are someone who is driving your car a lot, or if you are someone who is in front of the computer a lot, or if you're like me and you're in front of a microscope a lot, this is all going to reduce your blink rate. And when your blink rate goes down, your eyes are just naturally going to become dry. You may notice this if you're someone who has to like blink frequently to clear the vision. That's probably a sign of just your eyes are just working a little bit too hard. So try to take a break from the focused visual tasks that you're doing. use some artificial tears. You can sit with your eyes closed for a little while, but allowing yourself to kind of get back to that normal blink rate can be also helpful in treating your dry eye. The fifth natural solution or sort of home remedy is omega-3 fatty acids. Now, this advice comes with some caveats because the studies around omega-3 and how much it really helps dry eye are not that strong. But if you're getting a proper amount of omega-3 fatty acids from food, that's very safe with little downside. And even if you decide to take a supplement, just make sure that your doctor is okay with it, and you're checking all your other blood levels and making sure that there's no reason that you can't be on an omega-3 supplement. And when you're eating it through your food, you want to also make sure that your cholesterol levels are okay, because a lot of omega-3 rich foods can also have higher cholesterol levels. But remember, the evidence to support its specific use for dry eye disease is very limited. So if you feel like it is helpful to you, certainly as long as you're taking the supplement safely or you're not overdoing your omega-3 rich foods, that should be fine. But how much it's going to actually help you is going to be very personal because the data on it is kind of limited. Now, of course, if natural solutions are not working for you, you want to talk to your doctor, because there are actually a ton of dry eye treatments that can be done to help you not be miserable from dry eye and help you see well. Hope you found this helpful. Please hit subscribe below to support the channel, and I'll see you in the next video.